More than 5 million Americans diagnosed. Chances are you have a loved one who has Alzheimer's. Dr. Barry J. Riskin with the Christie Clinic is here for today's Med Live. Thank you so much for being here with us.
My pleasure.
First, just briefly explain the difference between Alzheimer's and just dementia.
That's an excellent question. A lot of people get confused about the terminology. Dementia is a description of a loss of brain power over time. Alzheimer's disease is the most common form of dementia. Approximately all dementia sufferers, about 70% of them will have Alzheimer's disease, which is a particular kind of dementing illness. Other kinds may include stroke, brain trauma, Parkinson's disease, but Alzheimer's disease far and away is the most common.
So how is Alzheimer's diagnosed?
It's another very good question. Historically, if someone, say, at the age of 75 years or younger, presented with a loss of brain power. And by brain power, we mean not just loss of memory. Patients and families, friends, they think of Alzheimer's disease as exclusively a memory disorder, but it's not. It's a loss of the ability to perform activities of daily living, something like washing, dressing, cooking, even driving. It's a change in personality or behavior, as well as a loss of executive function, the ability to plan, to carry out function, motivation, insight, creativity. All of these suggest brain power, what our brain does. And when we see a loss of these kinds of abilities over time, we call that dementia. Now, if you were to talk to a patient and, most importantly, have someone to corroborate the story, to make sure that there has been a loss of these functions over time, the likelihood it's Alzheimer's disease. What we do as neurologists and other doctors, we make sure it's not something else. We take a picture of the brain to make sure there's no stroke or tumor, swelling on the brain. We take blood to make sure there's no vitamin deficiency, inflammation, sometimes infection. We make sure that there's no toxic exposure, etc. So once we make sure that there's no other process ongoing to explain the loss of brain power, it's most likely Alzheimer's disease.
Any treatments available, therapies?
There are treatments available, and they have been for some years now. The treatments work to help the individual maintain their function. They're not cures. Sadly, there's no cure for Alzheimer's disease. The medicines can help the individual with communication. They can help them with their behavior. The three mainstays of therapy include two drugs which are of the same class. We call them cholinesterase inhibitors. These are medications that change an enzyme. Enzymes are proteins that do things in the brain and elsewhere. One is called donepezil, another is called rivastigmine. These are taken on a daily basis. Another medicine that works in a very different way, called memantine, can also help promote the brain function.
I think the age-old question is, how can you and I prevent it in ourselves?
Well, that's a question everybody wants to know, and greater minds than ours, and there are lots of them around the world, have spent billions of dollars trying to answer that question. And sadly, there's no true or convincing way to prevent Alzheimer's disease. In approximately 5 or 10% of individuals, Alzheimer's disease is genetic. It runs in families. But for the other 90 or 95% of individuals, the disease is sporadic. It happens for reasons unknown. As our population here in the United States gets older, it's estimated that by mid-century there will be maybe 14 million Alzheimer's sufferers. So the way in which we try to prevent Alzheimer's disease is to try to use your brain. So we tell folks whether it's to do crossword puzzles or go to church, engage with people, have a hobby. We find that those people who have higher levels of education, who have more interaction socially, who have hobbies, their brains are somewhat protected from Alzheimer's. Other than that, general nutrition, exercise may be helpful, but there's no clear or convincing way to prevent the disease.
Okay. Dr. Barry J. Riskin, thank you so much for being here, neurologist at Christie Clinic, and we will put all this information on our website. You can watch it again by logging on to IllinoisHomepage.net, click on the morning show, and look under Med Live. We'll be